Hi, my name is Brandis Boyd Cooper, and this is BioMaze Coordinator Chronicles Healthcare from A to Z. Today I have several special guests. We're going to start with introducing one another. We'll start to the young lady to my right.
Hi, my name is Faith. I am a biologics coordinator and clinical research coordinator at Las Vegas Dermatology in fabulous Las Vegas.
Ooh, ooh.
I met Brandis at a speaking gig a long time ago. She was speaking for a pharmaceutical company, and we've just been like this ever since. Happy to be here.
She's
Thanks
one of my
for having
besties.
me.
Thank you for coming.
Hi, my name is Selena, and I am an implementation manager for Medico CX. I actually handle and manage multiple practices in different states, and I have been with Brandis for the past 2 years and counting now.
Yeah.
Trying to help out in this healthcare world that we live in and just trying to navigate that patient access.
That's pretty awesome.
Hi, my name is Crystal. I am a biologic coordinator, prior authorization specialist. I've been with Brandis maybe a year or two. I don't know. It seems like forever. But I'm also with BioMaze and ACBC.
Well, I'm so grateful that you all are here. I know we're here for our conference this week, or this weekend, the ACBC conference. And I know we had kind of prepared to talk about disease states that have been most impactful to us. But as directors, I felt like the audience needs to get to know us a little bit personal. And so I want to talk about something that has really impacted our lives, because each and every one of us on here has a story, and a story that we're either currently going through or that we've been through that can be an encouragement to somebody else. Because it's one thing to know that we're coordinators and we're fighting access for other people, but they don't realize, sometimes we have to fight for ourselves on the other side, and how we can still hold our heads up high and still fight for other people, even in the midst of our storm. And a lot of people don't know this, but my ex-husband was ran over back in 2012 and suffered from a traumatic brain injury. And during that time, not only was I being a single mom at that time, because he was in a coma and in the hospital and trying to heal, but I was also working, trying to fight for my patients, still hold down the job, the fork at home. And it becomes a lot, and people don't understand, you're all smiles in front of people, but sometimes on the back end, we're still fighting and struggling. And I just kind of want to dive in and just talk about our stories today, if you guys don't mind sharing some of that, just a little bit of yourself.
Absolutely.
Who wants to go first, besides me?
I think the host should go first, so we know
I just
exactly
did.
That's it then.
I talked about the brain injury. I talked about the struggle.
I can go. We can go around the circle.
Mm-hmm.
A lot of folks don't know this story about me. I don't share it very often, just because it's very personal to me. But I feel like this is the safest space I'm ever going to get to share it. So, my mom was just my hero. She's my everything. And when I was in fourth grade, she had a major stroke. She was only in her 30s. She did suffer from lupus and factor V blood disease. So she had, chronic illness pretty much my entire life. And it culminated in a major stroke where she was in the hospital for, I believe, about 6 months or so. And when she came home, back then when I was young, we didn't have the resources that we have today. So the home health ended up falling on me. My dad had to work, so, it was just me and my mom at home, and I would take care of her and cook and clean and still do schoolwork and try to keep, my childhood as much as I could. And that was my life from fourth grade up until I graduated and went to college, was taking care of my mother. She passed away 2 years ago, very suddenly, and I was 5 months pregnant at the time, and everything I do every day that I wake up and I go fight and I advocate for my patients, it's all for her. She was my first patient, my mom, and she, is always held dear to my heart. And every time I think, like, this is so hard and I don't know if I can do this anymore, I think about her, and I think about how I would want somebody to fight for her, the way that I fight for my patients every day too.
It's crazy that God puts us in certain situations to know how to fight. Because my best friend's mother passed from lupus several years ago, and I never thought that I would be an advocate for lupus. Like, that was never a thought that even crossed my mind. Like, and just seeing all of those signs and things that she's gone through and how she just gave up. She literally gave up her fight. She was like, I'm tired. And I only know that because she ended up being my patient. And at that time, I didn't understand all of the factors of lupus. And she was just like, I'm tired of medicating. I'm tired of hurting. I'm just done. And my best friend actually found her. She was calling her mom, and wasn't getting the answer, and climbed up into the window of her apartment and found her passed away. And she had passed away from lupus. So anytime my favorite doctor, Dr. Costner, throws a lupus patient at me, that's what I think about. I think about, fighting for that patient that hard so that they don't feel like those struggles are with them. So I commend you, because fighting through that, being pregnant, I understand exactly how that struggle was probably, I probably don't understand the exact moment because I was your mom. But I understand exactly what you went through, like as far as like the pain and trying to live and still survive and still fight and still smile every day you go to work.
Funny enough, my son came out looking just like her.
Oh my gosh, that was the angel.
Yeah, that was the angel.
Angel in the sky.
She was like, "You think you're gonna get rid of me?"
100%.
Here you go.
So does he have our attitude?
Yes. Her short woman Italian attitude you came out with. I'm like, giving me a run for my money.
I love that, reincarnated.
Yeah,
100%.
exactly.
That's
Everybody's
how
like,
you,
"Yeah, you want a second?" I'm like, "One's good."
I will go. So I think for me, just growing up in life, what got me into healthcare started as a teenager. My grandfather had cancer. My uncle passed away from HIV. Later on in life, my mom had breast cancer. My grandmother had Alzheimer's. So just going through life with everybody in my life that has meant something to me, having some type of illness or diagnosis or something, it's been impactful to me. So I knew I always wanted to do healthcare, and figure out what I could do to help them, how I could fight for them. So that's how I got started on my journey. In high school, I knew I wanted to do healthcare, but I knew I could not deal with bodily fluids. So I was like, I can't do it. I just can't. Everybody's bodily fluids is their own. But I knew I wanted to fight for them. I wanted to find ways to help them, to help educate their families. I remember being in 11th grade, knowing that my uncle had AIDS, HIV, and knowing that it was still taboo, knowing that there has to be something to educate families, knowing that we have to get the message out there that, there's still help. There's other ways we can help patients, help their families understand what's going on. And, he didn't have insurance. He had all these medical bills, and my mom being, she's always been the matriarch of the family. I don't care who was around, but she's always been the matriarch, take on everything. And I was like, why is my mom trying to figure out how to pay these bills, what to do? And I wanted to help her, and I knew I wanted to be a part of the fight. So that's always been me. And now I deal with migraines. So as somebody who has to fight for myself as well, because I would go to the hospital dealing with migraines, and they would always say, "Oh, you're just seeking medication. You're just, and I'm like, no, I need to figure out how to fix this. I don't want to deal with this. I don't want to be in pain. So that has always been my fight. And so now I want to fight for patients, because I need them, doctors and, staff, to understand patients want help. They don't just want medicine. They want to cure their illness. They want to seek better life quality. And if I can fight for them, that's what I want to do. And that's what drives me every day.
Yeah.
100%. Yeah, no. I have to say, when it comes to my journey, there's multiple factors that really come into my journey, and it starts when I was a kid. So I actually ended up having to be admitted into a rehab center because I had attempted to commit suicide on multiple attempts. It took a lot for me. I was in a very, very dark stage of my life, and I really didn't think that I was actually going to get out of there. But, you know, I got the help that I needed. I acknowledged that I needed the help at that point in time. And from there, I had gotten the blessing of having my kids. And I'm going to say that my kids have always been my lifesaver when it came to, you know, where I'm at today and just tooting along, should I say, in this normal day-to-day life. I mean, life is not easy. We can all definitely sit here at the table and say we have gone through so many struggles in our life. In different aspects. And leading into that, my 4-year-old daughter ended up having a conditional heart defect. And so she was diagnosed with hypoplastic left heart syndrome, which means that she is missing half of her heart. She originally had a 50% mortality rate. And when I first got diagnosed with this, when I was actually pregnant with her, so we were able to catch it early. But the challenges of that were so complex. I mean, we traveled out to Texas Children's Hospital in Houston, which they are known to be the top notch for these patients who suffer from HLHS. And I was an absolute wreck. I mean, at that moment, I was in the billing and coding side of things for the healthcare industry, and I was working remotely by her bedside every single day. And so she underwent her first open heart surgery at 7 days old. And from there, it turned into her next open heart surgery at about 2 months old. And we're actually looking at her third one happening this year, by the end of this year. And so it's been a very big challenge because I have been on that side as a patient, a frustrated patient, an angry mom of why are all these things happening to my daughter? Why my daughter? I've undergone multiple tests from the beginning all the way to the end of just trying to figure out, where did this come from? Like, why did she get this diagnosis when all my other children are as healthy as can be? And it literally just came down to that she was just that 1% out of the many kids that just happened to get it. And so coming from a mom, you know, it was very frustrating to me to hear that answer, because I was like, why? Like, why, Lord, why me? And so it was a big challenge that I had to go through. But going through that, it gave me all the motivation that I understand the frustrated side where patients come from when they need their access and they can't get it, or when the financial bills are too high for them and they don't know what's going on. I've been on that side, and being on that side has really opened up my mind to be able to make sure that I take care of my patients just how I want my daughter to be taken care of when she's undergoing those surgeries. And we have to also remind ourselves that we have to be nice, right? We have to be compassionate. We have to be caring, because yes, we may be the patients at one point in time on the other side, but we also have advocates like ourselves here at the table who are trying our best to get those patients access to their therapies, to change their lives. And we run across challenges. We run across daily challenges, from insurance denying things for the slightest things, when we have all validation that the patient should be on these treatments. So I've seen really both sides of it, and it just gives me the more motivation as to keep on going and doing what I do in this industry. That is where where my goal has come from. I mean, I want to be treated with respect, just like everybody else would like to be treated with respect. But we also need to have empathy for our patients of the frustrations that they go through on their end. So it's really just seeing that bigger picture and making sure that we're kind to one another. We're all human beings. We're all in this world. We're all going through challenges and day-to-day life things. And so to have that reminder in your head every day that, you know what, that person is trying to advocate for me, that person is trying to help me, is the biggest thing that I can possibly advocate to anybody. Because once again, I've been there, I've done that, I've seen both sides of it. I've gotten cussed out by a patient, you know, because of the frustration. And I get it. I totally understand, because I have been that mom, frustrated as to why is my daughter going through the things that she's going through. So it's really just having that that empathy, that compassion, and that motivation and that drive to want to make somebody's life better. And so that's kind of where my history comes from, to be completely honest. If I wouldn't have been put into the position of my daughter's heart condition, I don't think I would have found myself here today.
Yeah. It's crazy because we all have like that journey or that story. And so you all know I've suffered with like asthma ever since I was like a little kid. And oh my gosh, being a military brat and being treated by the military, you guys, it's awful. I love our Air Force. I love that they protect and serve. Thank you for all that you all do. But the service that we get as far as healthcare, you guys see what we go through with the VA. It's ridiculous. We can't get medicines.
Yep.
The medicines that they need, they want biosimilars, they want methotrexate. I'm like, what is this? Like, are we still in the 1990s? We're in the dinosaur ages, treating these patients. Or I even talked to a patient that said that he had been on the wait list for a oncology surgery that he needed for almost 2 years. And I was like, I am so sorry. But with me having asthma, I think that also lit a fire kind of underneath me, because ever since I was a little girl, I knew I wanted to be in healthcare. I was like, I'm going to be a doctor. That's what I wanted to be. And being from Louisiana, they really push healthcare because that's where like LSU is, that's where Xavier is. And they let you visit different like rotations of different events. And I'll never forget seeing open heart surgery and blowing up a heart. And I was like, oh yeah, I'm definitely not doing cardiology. I was like, nobody's life is going to depend on, I don't want nobody's life in my hand like that. But I still wanted to be in healthcare. So just seeing like everything, and I saw, understanding how you were mentioning all of the elements. I mean, it's just like my grandma, y'all, she's like a walking dictionary. She's literally had every single thing in the book, from brain tumors to diabetes to high blood pressure, and like she can tell you how to treat something. She'll pull out her little book and be like, the doctor said to do this, and I'm like, where'd she get this book from? But just seeing like all of these different elements like in your family and it just kind of makes you want to advocate for everybody. And it's crazy because patients don't understand the frustration of us, because we get frustrated too when we get denials, right?
100%.
They don't understand it, and insurance is not making it easy, especially not now.
Every year they're making it harder and harder. It's like once we figure out that we know, okay, you know what, we know what to do, and we know how to get this and this and this and this, and it's like they say, you know what,
We're going to tweak it.
we're going to tweak it just a little bit more to make it a little bit
Girl,
harder.
CVS Caremark caught on to my little trick with Tolt this year, and I was so mad because they changed the formulary again. I was like, oh!
And exactly, just what you just said. Once they know, once we can get it approved, and they're like, oh, we're going to change the formulary, because you know what? They're getting it approved, and we're having to pay for it now, and we don't
And
want
they
to
don't
pay
want to
for
pay
it.
for it.
100%.
I think it's so interesting that you had, said about like not wanting to do cardiology and stuff because you didn't want somebody's life in your hands, but that's exactly what we're doing. Like these people, like their quality of life is so severely affected by like their chronic disease state. You think about like in the dermatology space, you think about people with psoriasis, and like 30% of those people develop psoriatic arthritis. They're in constant pain, agony, they're itching, they're bleeding, they're exhausted. So without like these drugs that we're asking for, what kind of quality of life do they have? So, their life and the way they live it is still in your
In our
hands as a
hands.
coordinator and as a healthcare advocate. And you would think that, insurance companies would take our word for it, or take an MD's word for it, or a physician associate or a nurse practitioner, and say, okay, well, if they think that they need this drug, then they probably need it. Instead of, actually, here's 10 hoops that you need to jump through to get it. Good luck.
I love it when they ask, is it medically necessary?
I like how
Why did I ask?
I like how Faith mentioned that. It's like you would rather have your say versus what a doctor or a physician or a mid-level who knows more, like
Who actually specializes
who
in that.
specializes in that. Like, you are an insurance company, but you're saying the doctor doesn't know what they're talking about. Like, That really
I love it
blows
when
my
a
mind.
pharmacist denies it, or you get somebody on the line that can't even pronounce the words.
Right.
Oh my goodness.
No, I think what I really like the most out of all of that is when you're submitting into whether it's dermatology or, gastro or
Yes.
whatever it may be, and you have an OBGYN reviewing that
Uh-huh.
PA and saying
No,
denied.
a family medicine doctor or
Yes,
general
ma'am.
practice.
How about a chiropractor?
Yeah.
Yes.
I mean, let alone like we can only keep up with all the different specialties and all the different medications that we handle, let alone a general,
Yes.
practice that it's like, okay, well, I'm just going to say no because I'm not familiar with this drug.
No, I got you. When you submit an authorization and the people are just checking yes or no on the screen and they say, oh, it's denied. Really?
Or when they don't read the chart note and click
Yes.
no. And then that's 30 days out of my patient's time
Yep.
to wait on an appeal because you couldn't read thoroughly enough.
Dr. Costner once had a peer-to-peer reviewer with a provider that was on a treadmill.
Are you serious?
Wow.
She said, I've never felt so disrespected in my life.
Disrespect towards the physician that you're on the phone with and also towards the patient.
Yeah,
Correct.
100%. I mean, let's not forget this trickles down the line, right? We don't get our patient their therapies. It affects their quality of life. Not only does it affect their quality of life, but where do you think their mental health gets them eventually? The constant struggle, the constant itching, the constant asthma attacks, whatever the diagnosis may be. Do you really think these people are going to want to continue on with their day-to-day lives of these struggles?
Right.
It's eventually going to get to the point where they're just exhausted and they're going to be like, I'm done.
They don't want to fight anymore.
And so I think that's another huge issue that we come across with our patients is the mental health side of things, right? And making sure that they know that they're taken care of and we're trying our best.
Yeah.
But yeah, definitely out there within this industry, they're not making things easier, and it's very unfortunate because we're the ones that are having to take that bullet. The patients are the ones that are going to have to take that bullet. And that's why so many people out there right now are so frustrated against these insurance companies because, once again, every slight change, they're trying to tweak it. They're trying to make it a little bit more challenging. Blue Cross Blue Shield of Texas policy, trying to implement self-administration for these medications for the respiratory biologics. Those are the tiny things that it's like these patients are reaching out and they're like, I can't self-administer. I can't do this. And I'm like, this is like literally one of their threats. And it's unfortunate because it shouldn't have to rely on a policy stating or mandating to self-administer. It should rely on, can the patient even self-administer, and they can't, then there should not be any other option other than administering in office. There's just a lot of key factors that we struggle with on our biologic side world for a biologic coordinator that it's absolutely ridiculous.
How do you guys think AI handles these questions?
I don't
Not
think
well.
they do. I don't think they do, and I think they probably get denials, and so I think that's where a lot of offices are. They think, oh yeah, I'm gonna use AI because it's gonna be cheaper. I don't have to pay a biologic coordinator, but they're not realizing you do not have that
Human
patient
touch.
that human person fighting for your patient.
Yeah.
100%.
You also have to think about, like, AI learns from what you put into it. So, it's not always right 100% of the time. You still have to fact check it. And who's doing that? Or are we just submitting false information and getting more denials and then wasting more time? So, the biologic coordinators and the healthcare advocates, we're there for a reason. And, there's not very many of us, and that's unfortunate. But, I think that the use of AI, it has its circumstances. If you want to tweak an appeal letter, or like, can you pull up some clinical research that might help me, or can you give me some sources that might be able to bolster this and give me a better outcome. But just flat out using it to do our job, it's going to get you nowhere.
I agree 100%.
Where do y'all see the collaboration in 5 years? Do y'all see any collaboration?
I feel like you may have collaboration from the aspect of a medical doctor standpoint, and I go back to a lot of our doctors who use paper charts still and don't use the electronic system. they do have AI scripts out there and resources to where they can simply just, it's almost like a dictation, right? They dictate and then the AI creates up the template and they're good to go. But once again, it still goes back to who's triple checking. Is that fully accurate of what was picked up? And it's whether or not is the provider going to want to do that extra work. But when it comes to a standpoint of an AI being the biologic coordinator and submitting those prior authorization, it's very hard for me to believe that there would be a decent collaboration within that aspect.
There's so many corporations out here who are thinking that that's the way to go because of it taking over salaries and eliminating on jobs, and even like as far as like the medical assistants are concerned. I've seen how you're talking about dictation. It really does concern me because what is the AI missing? And a lot of times we're able to get a feel of the patient, and AI can't do that. So like, how are things being submitted? How is Cover My Meds really able to capture, like how are they capturing all of the data that they need? And I just don't understand how these corporations are moving towards that.
As somebody that came from a big corporate space, I was a clinic manager. At the end of the day, a lot of the times it comes down to the bottom dollar. What's going to save me the most money? But that's not going to be right for the patient. When is healthcare going to start being about the patient again? When is it going to stop being about insurance companies saving $10, $20 a piece to make them go on methotrexate and go on these cheaper drugs, when we could just be giving people the best drug every time, the best drug to give them a better quality of life?
So the reason why I wanted you guys to kind of open up about your stories, because that's our why. And when we start remembering why we're doing things, it makes us be able to advocate even more. And that was the purpose of today, was to actually ask you your why without me asking your why. And so I really do appreciate you guys even opening up to me today. And I think we're going to be ending this session. So thank you guys for being here.
Thanks for having us.
Thank you for having us.
Thank you.